Hello, my name is Shannon. I'm a student physical therapist, and today I just wanted to talk to you a little bit about phantom limb sensation and phantom pain and what you can expect with those. So, phantom limb sensation is just a feeling that your amputated limb is still there and still intact, but there's not really any pain associated with that. So, phantom limb pain is when you feel pain in that amputated limb as if it's still there. So, some of the more common feelings tend to be like burning or stabbing or some cramping, which is kind of common in patients post amputation, as all the nerves that go to the area where your lost limb used to go now don't have anywhere to go. So they used to trigger those muscles down in your lower leg. And so as those muscles aren't there anymore, they're kind of just trapped in the remaining part of your limb. So because of this, they can send signals that are kind of like misinterpreted by your body. So these symptoms can be caused by pressure on the remaining part of your limb. So even just clothing can aggravate that and cause phantom pain sometimes. So good news is usually this gets better over the course of a few months, but it might be aggravating for a little while. There's a small chance that those symptoms could go on for a while longer than that, but we're going to do our best to keep it to a minimum. So we can treat this pain if that does occur to you in the clinic with mirror therapy and something called desensitization. So desensitization can help decrease how sensitive the remaining part of your limb is. So it's kind of like you put a lot of pressure on your elbows all the time, so you can't really feel those because the nerves are kind of just like all worn out in there. But your fingertips and stuff that aren't touched quite as frequently have a lot of sensation in there. So right now, where you're amputated is kind of like your fingertips. So it's just really, really sensitive, so the lightest pressure can bother that. So desensitization can kind of just like make the end of your limb more like an elbow, so it's not as aggravated by little pressures and stuff like that. So another thing that we do really frequently is called mirror therapy. It's been proven to help patients that are struggling with phantom limb pain to visualize or kind of even trick your brain into thinking that your non-amputated limb is actually the opposite limb, so the limb that has been amputated. So your brain kind of perceives the sensation of the unaffected limb as sensation to the lost limb, and it can help resolve phantom pain. So I hope that answers all of your questions. Please let me know if you have any other questions at all. I'd be happy to clarify for you. Thank you. Have a great day.